I'm Gita Mody. I'm a thoracic surgeon in the Division of Cardiothoracic Surgery and an assistant professor of surgery. I was inspired to become a doctor by my father, who's a retired pathologist. From a young age, I would go into the hospital with him, sit next to him while he looked in his microscope, watch him making discoveries. But actually what impressed me the most about him was how much he cared for the patients who were relying on him to make a diagnosis for them, and how much he cared for his own team, which is an example I try to follow. I think that the primary reason I became a specialist surgeon was I had great role models and great mentors along the way. So when I was a third-year medical student, I rotated in cardiothoracic surgery at Washington University in St. Louis, and there are some world-renowned heart and lung surgeons there. And I looked up to them quite a bit, and so those were my role models. I felt like, again, they could operate anywhere, they could do anything the patient needed, and I found that very inspiring. So as I started my training, I joined the general surgery program and cardiothoracic fellowship at Brigham and Women's Hospital in Boston, and there I found mentors who were people who wanted to make me into the best person I could be. These were thoracic surgeons in the Division of Thoracic Surgery, and they are incredible in their ability to deal with any problem that comes their way, and they helped me to become that person. So in doing so, I became who I am today, which is a surgeon, and a mother, and a wife, and someone who cares immensely for people, and again, feel so lucky to be able to use the skills that I have to help my patients every day. The thoracic surgery is surgery of the chest, and it can involve many organs, the lungs primarily, the esophagus as well. We operate on the diaphragm, on the lymph nodes in the middle part of the chest, on the airway. We deal with problems ranging from cancer to benign issues such as strictures or hernias. And actually one of the things I like best about thoracic surgery is I feel like we can operate anywhere and do anything that need be to make sure our patients come through surgery just fine. Inspired by my father, who told me stories of being a young doctor in the districts of East Africa, I began getting involved with medical missions from over 15 years ago. And that service, that giving back, I found very rewarding, and it led me to my work today in academic global surgery, which has to do with surgical capacity building, including strengthening systems and developing research programs, working alongside surgeons in Latin America and East Africa both. So the reason I became a surgeon scientist is because I think that the work that we do in our research and in our clinical practice well complement each other. When I see a patient, I'm constantly asking questions. How can we do better with what we have, and how can we make the outcome better for that individual patient? So in that way, if we can rigorously research those questions using scientific methods, I think that we can improve our overall clinical care. UNC is full of people who are caring, kind, and thoughtful. And what I see every day is that people at UNC put the patient not only at the center of what they're doing, but they put the patient first in every action that they take. And that, I think, is really important, because that's why we're all here. Teaching is one of the most rewarding things that we do every day. Teaching a young surgeon how to do a procedure that maybe they've never done before or seen before is very rewarding. It can be a moment of transformation for them if they see that they can achieve outcomes that are great for patients with their own hands, and is a moment of satisfaction for us as well, in that we see that what we do every day is helping others grow to who they are ultimately going to become. I would like my patients to know about me that I would take care of them as if they were my own family member. I think that's important, having been the family member of a patient myself, that they see that I will take the time to get to know them, to answer their questions, and make sure that as we enter the relationship of surgeon and patient, that they are completely at ease.